Dr. Garrett Wiegriff here at Pure Plastic Surgery for another edition of Thursday Thoughts. Today we're going to be talking about some abdominoplasty questions or tummy tuck questions. So please send those in if you want that answered right now. And I want to remind everybody, please go check out our website, pureplasticsurgery.com. There's a place to get started for consultation, get quotes about different surgeries, and right now we have the Christmas Came Early special for me. There is only a few spots left before the end of the year, so if you're really interested in getting a great deal, please look into that soon. And we're probably not going to have another big special like that for a long time, so now is the time to take advantage of it. So, without further ado, let's talk about tummy tuck, or the technical term abdominoplasty. And I think we got sent in a few questions.
Yeah, that's right, Doc. We have a few questions here. The first one, is it possible to have a tummy tuck and a fat transfer to the hips?
So yes, and you guys have probably heard me say, I do not do tummy tucks and BBLs at the same time because of the recovery from these surgeries. They're two competing surgeries when it comes to recovery. You have to stay off grafted fat so it can establish a new blood supply. But when we're doing a tummy tuck, and if we're just addressing some areas on the lateral hips, not on the butt, we can do fat grafting at the same time because you're not laying on that part of your lateral hip. You just need to be really careful about how you position yourself in bed to get the best result.
Okie dokie. There's another one. Is muscle repair always necessary with a tummy tuck, or is it depend on individual?
Yeah, so that does depend on the individual. I would say most people, even if you haven't had kids, we do some degree of muscle repair because that's just another way for us to better your contours by tightening everything up. But I think most patients will benefit from a muscle repair, but not everybody needs it. And also depends on the type of tummy tuck we're doing. Certain things like mini tummy tucks where we're not elevating the belly button, we can't do a full muscle repair because we're not undermining going up high enough to do that.
Okay, TikTok's on fire right now, and we have a patient that's coming for a tummy tuck in January.
Perfect.
Patient of you, and she asked if everyone could have a drainless tummy tuck.
Can everyone have a drainless tummy tuck?
Correct.
So most patients are a candidate for a drainless tummy tuck. I have a few exceptions. If you're a BMI over 32, I don't think it's a great idea to get a drainless tummy tuck. And if you've had previous abdominal surgeries, especially Lipos Suction, I don't think it's a great idea to have a drainless tummy tuck because you have an increased amount of scar tissue underneath your skin, and there's a little more likelihood of forming a seroma after those patients. But other than that, basically everybody is a candidate for a drainless tummy tuck, which I'm sure we will talk about more in the next few questions.
Correct. And can I do a lipo 360 and my breast at the same time?
Yes, you can do a lipo 360 in your breast at the same time, assuming that you only have a very small amount of fat that we need to address, because in the state of Florida we have certain rules about how much liposuction we're allowed to do at the same time as a cutting procedure like a breast augmentation. That limit is actually 1 liter. Some patients are a candidate for that. You know, they don't have much more than a liter for a 360 lipo, but I would say most usually require a little bit more than 1 liter.
Okay, we keep getting new questions. I'm going with
Perfect.
this. Doug, okay. I'm having surgery with you in February.
Awesome, can't wait to see you in February.
When I fly home back to PA,
That's okay.
okay, do you have any recommendations for my flight because it will be about 4 hours, I think?
Yes, so always recommendation for flying is, if you can, get an aisle seat so it's easy for you to get up and walk around during the flight. That's really the main thing we need to do, or even if you're traveling in your car, you need to stop frequently, every 1 to max 2 hours, but closer to every 1 hour to get up and walk around. That's going to greatly reduce the risk of you getting a blood clot in your legs. Also, most of our patients that are getting tummy tucks or lipo 360s, they're going home with the VenoPro devices, which is the Device very similar to what patients would wear in a hospital that squeezes their legs and decreases the rate of DVT occurrence.
Okay, this is a comment and said, "You performed surgery on my father's wife and she spoke highly of your work. I will contact you because I'm planning to have surgery. I live in Massachusetts."
Well, great. Thank you. I appreciate that. And your father's wife, I hope your mother-in-law is doing well. And I look forward to meeting you.
Okay, Doug, we have YouTube with questions too.
Okay.
I had a BBL last year. Only the bottom, my stomach was done now. I'm feeling tightness in my stomach. What do you recommend?
So you had
Tightness.
you had a BBL and now you're feeling tightness. It can be a few different things depending on what your exam shows, but sometimes some people develop some degree of fibrosis, which is just the scar tissue that happens underneath the skin. The things that we can do to really decrease that or improve that is wearing the garments that you're supposed to wear after surgery, getting a massage. If people have really uneven liposuction, one of the things we can do for them is oftentimes do an abdominoplasty, and that helps with the unevenness from that scar tissue that may have formed if somebody did a poor job with liposuction.
Okay. Somebody asked, can you do a drainless mini tummy tuck?
Yes, absolutely.
Drainless mini.
Drainless mini, that is possible. A lot of people assume they're a good candidate for a mini tummy tuck, though. I would say it's a minority of people that are a good candidate for a mini tummy tuck. So send us your pictures, let me review it, and I'll tell you what is the best option for you.
I live in Connecticut. Coming down next month for my tummy tuck. I'm so nervous but excited at the same time. Woo!
You're in the right hands. We're going to take great care of you. Look forward to seeing you in Connecticut. It'll be December. Good time to come down to Florida.
Hello. I want to know how long it is advisable to wait for a BBL after mommy makeover surgery.
Very least 6 months. Waiting up to a year, I think, is really ideal. Whenever anybody has any type of operation, you're going to have scar tissue, and our body takes a while to remodel its tissues to make them soft and pliable and easier to work with during surgery. So whenever you're looking at a second surgery in the same area, minimum of 6 months, closer to a year is ideal.
Okay, this is the son of the husband of your patient. Yes, he said, "Can I have high definition lipo? I'm a little scared. I heard it's dangerous."
Absolutely. And high definition liposuction is really no different than regular liposuction. It's just a little bit of how aggressive we go in certain zones. And we actually leave a little bit of fat behind in other areas. That's what gives the definition. And I would love to help you out with that. High definition is a great option. The man behind the camera can attest to it.
Yes. Okay, Doug. This is a quick question. Which part of Florida are you?
We're in Miami, Florida.
Is recovery from drainless tummy tuck different from or faster than traditional tummy tuck?
I think it's real hard to say, it would be real hard for me to say that it's faster. One of the advantages of a drainless tummy tuck is there are additional layers of suture that are attacking the skin and fat that I elevate up off the muscles back down to the muscles. And I do believe that increases how quickly it starts to heal because there's no shearing forces. That abdominal flap is not shearing over the muscles because it's tacked in place with those additional layers of sutures. With that being said, recovery from a drainless tummy tuck, the important thing for it is wearing the garments and getting lymphatic massages. I really think that is key to having low complications with that procedure.
Okay, Doc, this is a comment for you. The best doctor ever. I call him Dr. Painless. He did my BBL on Lipo 360. I follow all his protocols and everything was very smooth and painless recovery.
Wow, I appreciate that, and I think I have an idea of who that is.
Oh, Doc, can we have one?
I would not say you can do high def lipo with tummy tuck. You can do soft ab etching for the right candidate. If you're overall pretty fit, and one of the main issues you're looking to correct is your diastasis or your muscle separation, you may be a candidate for soft ab etching. I would not call it high definition.
This is a good question. I work in the medical field. I will not have to leave patients. Do you think it's possible for me to return to work within 3 weeks for the night shift to the hospital after a tummy tuck?
As long as you're not holding patients up or rolling them or anything like that, I think 3 weeks is very reasonable.
Yeah, she's a respiratory therapist.
Yeah, RT, I think that would be very reasonable to go back at 3 weeks. You still may be a little sore. Tell all my patients for the first few months after a tummy tuck, if you're up working long, busy days, you will have swelling on the lower abdomen at the end of the day. You wake up in the morning, it all goes away. It takes a while for those lymphatic channels to heal and to get to the point where you don't build up that swelling by the end of the day. All right, everybody. Great questions. I really appreciate the engagement. Please tune in. Actually, next week I am on vacation, so we're not going to be doing it next week, but we will be doing the follow. But I hope you all have a great day, great weekend, and I will see you in 2 weeks.